Myositis family. It's Benita Moyers again. I'm your MSU Vice President and the founder of the Myositis Moon Walk. And I'm here with my fellow three Myositis Musketeers. We're going to have a special episode today leading up to the Moon Walk and our new patient voice workshop. So today I'm very excited to introduce to you Dr. Kelly Diaz. She's very special to me. She's my primary care physician. She has been there since the very beginning of my diagnosis, and she has just been a wonderful, wonderful asset to me. And she was unable to be at the workshop this year. She is going to be at the Moonwalk, but she was unable to be at the workshop. So I asked her if she would join the Musketeers today and just kind of talk to us a little bit about the importance of myositis awareness. So welcome, Dr. Diaz. Is there anything you'd like to say before we get started with the questions?
Just to say that I'm honored to be here with you all and very excited to see this event come to fruition and see all of you and the camaraderie and collaboration that you've developed. I'm truly touched and honored to be here.
Well, thank you. I appreciate it so much. I mean, you know how near and dear to my heart that this is. So, taking time out of your busy day just really means a lot to me. So, with that, we'll go ahead and jump into the questions and everything. So, one of the topics that we're going to talk about at the Patient Voice Workshop is educating doctors and educating patients, and how it's important to have that strong relationship, that open communication between the patient, your primary care physicians, and your specialists. And one of the things that we've heard from in our groups a lot is that patients are just afraid sometimes to ask questions or to share the things that they learn from their specialist with their general doctor. And so sometimes things get missed, and it's too late by the time they get put in the hospital and things like that. So why do you think, in your opinion, is it important for that patient voice to be involved in the treatment? In other words, why is it important for y'all to communicate effectively and learn from each other when dealing with such a rare and complicated disease like myositis?
Well, I think we need to start with the words of Sir William Osler. He said, listen to the patient. He or she is telling you the diagnosis. And that can be interpreted in so many different ways, but at the very basic heart of it, you just need to listen to what someone is saying, to truly deeply listen. They may not know the medical words or be able to tell you exactly the chronology of what happened. Sometimes there needs to be some back and forth to clarify. But I have learned, not just with myositis, with all kinds of conditions and situations, when you simply listen to someone and seek to truly understand what they're saying, they're telling you the diagnosis. Patients, people, they don't just make things up for fun. If someone's sitting there telling you that they're having a symptom or something is real to them or hurting them, it may not show up on a test, but it doesn't mean that it's any less real. And I think most physicians who learn to listen learn that. There's no way, especially in a field like family medicine, that we can know everything all the time. Many of us went into medicine because we like to learn and we like to grow and acquire that knowledge. There's a certain satisfaction, that comes from using clues and getting to the right answer. And most of us are groomed by 20 plus years of medical education to want to fill in the right bubble on the Scantron and know the answer and have a plan for our patients. We like to help people and feel like we're solving problems the same way that many people do. But I think that's what draws a lot of people to medicine, is that great satisfaction. And I think sometimes our patients may not fully realize just how difficult it is for your clinicians when we don't know the answer or we don't know what to do next to help. It's a very uncomfortable feeling that your healthcare providers have to learn to manage. Some of us can manage that pretty well, and some of us don't manage that well. And we just sort of shut down and start blaming the patient when we don't know. I'm sure you can all share some experiences, in that vein, and have had to live through that. And that's a difficult thing. So just having that humility for all of us, that we're all in this together and we're all learning, is very important. And I think too, patients can frame things in a certain way that can be helpful or frame things in a way that's not helpful. Just as an example, sometimes I have patients come in who say, I know what I have. I read it on Google and I'm here to tell you what treatment I need. That's immediately, of course, going to be a little off-putting to your physician,
Hmm.
because then it sort of takes them out of the equation, and puts them in a different role than what they're used to feeling. But I have patients sometimes who come in and they say, hey, Dr. Diaz, I've been doing some research, I've been reading, I just saw my specialist. Do you mind if I share a little bit with you about what's going on? Or do you mind if I give you an update? Can I give you this article to read? And that is a much more humble, collaborative approach that we can all appreciate, and I think that way that the patient frames it is important. Have you all, I see you nodding.
Yes.
Anyone else chime in on that one?
Well, and that's one thing that we keep trying to tell people too is that, Dr. Google can actually be quite scary. And if you look up myositis, and especially like I did with MDA5, it is terrifying when you see some of the statistics and stuff, and it's overwhelming, and you don't, it's just there's stuff everywhere. And so that's one of the things we try to encourage too is, make sure that what you're looking at is valid, make sure it's research based, make sure you're having open, communication. You're not going in and bossing the doctor around. You're trying to work together as a team to figure things out. And that's one thing it's really difficult with all the search engines and everything these days to help people understand, calm down a little bit. Yes, you need to kind of know a little bit about your stuff, but you're not the expert either. It's the collaboration, and that's just so critical and everything. And you pointed out something too about the frustration, and I know this is kind of not one of the things we talked about yesterday, but I know in the beginning you all were sending me to all the right places. You were sending me to a rheumatologist. You were sending me to a neurologist. You were sending me to a pulmonologist. And, all of them had these little bits and pieces of the puzzle, and nothing was actually coming together until it was a little bit too late. So it wasn't anybody's fault. It wasn't any reason. It's just it's such a rare thing. And like you said, not everything shows up on a blood test. And so, being open and having that communication, I think I called your office crying and I said, something is not right. I know what my blood work says, and I know this one rheumatologist says my blood work is fine. Something is not right. And when you switched me to another rheumatologist, boom, she had just read something about myositis and ran the panel. So sometimes it's just having that communication and saying, look, I know this is what's going on, and being open to looking further. And you all were very open to that, and that I really truly feel like that's what saved my life. But we have patients that are scared to even question sometimes, like, okay, well, they've said there's nothing there. There must not be anything there. They think the blood work is just the end all answer. And we're learning that, like with MDA5 and some of the other versions, our blood work might look normal. Our CK may look normal, and we're really sick. So when our CK goes up or something, it's like it's really bad. And so just get overcoming that fear of talking is something we've got to learn to do, both as patients and doctors, like you said, to listen. So I think everything you're saying is so very, very important for our patients to hear and for the medical professionals to hear. And with that, I'm going to turn it over. Jessica's got a couple of questions. I'll let her take over, and I'll come back in at the end and kind of close us out. So Jessica,
Thank you. And thank you again for being here, Dr. Diaz. It's really, really nice to get to meet you. We've heard some wonderful things about you from Miss Bonita, and you certainly have been taking very, very good care of her. And for that, we are incredibly grateful. So my question basically has to do, how has treating such a rare disease impacted your office and staff?
Well, I can certainly say that none of us had ever heard of amyopathic anti-MDA5 dermatomyositis before we met the unstoppable Benita Moyers. So, it was a huge learning curve for us. Of course, the physicians in our group had learned about dermatomyositis a little bit in medical school, but you can't learn everything and know everything about every rare condition. So there was a lot of fear, honestly, at first, because, like you said, when we Googled that and saw, we were seeing the same things, reading the same statistics that you were, and immediately understood, the very real ramifications that this disease can have for patients and specifically for our patient. And at first, my nurse practitioners who collaborate very closely with me, if they received a message or saw Benita for a visit, they would be scared, and even scared to recommend medical treatments because they didn't want to miss it. They didn't want to mess it up. They weren't sure, is it just a UTI or is it something more? So a lot of questions were directed to me at first. There was a lot of kind of just fear and uncertainty. And over time, with the education and communication that we've had with Benita, as we've learned more, as we've watched her particular disease process and her particular manifestations of it unfold, we've been able to gain a lot of knowledge and experience and kind of know, okay, is this just a regular sinus infection or is this something more serious? Could this be related to the dermatomyositis and need to be referred to the specialist or have more communication there? So it's a lot of confidence building and knowledge and back and forth, and not only learning the disease process, but learning your own patient. You've mentioned anxiety. I think everyone with chronic disease develops some degree of anxiety. And that's hard for both you and for us to sort through, how much is the fear and the anxiety driving some of the symptoms, versus what is something underlying that. And that can be difficult to tease out. That's where you really have to know your patient and work together. You have to be able to find your voice. Like we were talking about in that last question, you have to have your voice. No one else is going to speak for you. And sometimes you forget that between visits, your doctor's days are filled with lots of other things and many other patients, and they don't know what you're living at home. If something's not getting better, how am I going to know about that if you don't tell me? I've often talked to patients and they say, oh, well, the surgeon said I need surgery, and I didn't want to do that, so I never followed up, but I'm still hurting, and so how's that surgeon going to know if you never go back? How's your doctor going to know if you never communicate? It's important that we have those ongoing lines of communication, so that we can get to the bottom of these things.
Would you say, or has it affected how you deal with times of like severe illness or even times of crisis?
Oh my goodness. This question, of course, for me evokes the COVID pandemic in a huge way. I think, Benita, if I'm not mistaken, you were diagnosed just before the COVID pandemic, right around 2019
Mhm.
is when you got your formal diagnosis. And my goodness, what a scary time for all of us, but especially for someone living with a chronic disease in that high risk category, particularly with a disease process that can affect the lungs in a fulminant way. That was a very scary time, and that'll trigger a lot of anxiety right there.
Mhm.
So I can remember many situations, both with Benita and many of my other types of high risk patients during COVID, where knowing a little bit more about the disease process, having that education and that awareness of, hey, this disease can affect my lungs. If I come in with a cough or cold, we need to take that really seriously. We need to be aggressive about managing it, knowing, and as tools were becoming available, like monoclonal antibodies in our office, being able to offer that to patients like those with dermatomyositis, being able to get vaccines or other therapies to the people who need them the most and prioritize them. What an important thing to know your patients, in a crisis like that. I think I remember, and maybe Benita will want to share this, one time that you were stuck in your house because your driveway was iced over.
Yes. And I couldn't get the antibodies and I had COVID. Yes, that was very scary for them. They were like, "Is there any way?" I mean, we couldn't get the garage door open. There was no way of getting out. It was awful of
That
all
was
the times to hit.
right. But then just knowing that as soon as that ice melted, you needed to be the first appointment that next day
Mhm.
and be the first one to get it, mitigated that situation a little bit. But yeah,
Right.
these things do happen, right? We are put in crisis situations sometimes.
Well, that not only that, but I know like when I've had pneumonia and certain things before, we know that the ER and places like that are high risk for us because
Mhm.
we're so immune compromised. And you all have been really great. Y'all have kind of had a informal policy where if I message and it's anything to do with my lungs, you guys are so quick to get me in. And I think that's important, that when people know that how quickly we can crash with this disease from our lungs and things like that, how important it is to get a rapid response or get checked quickly to try to avoid that ER. The ER is always an option, but if we absolutely don't have to go there, getting in to at least see you all quickly is a good you know, thing to try at least before we go in there, because we know I've sat like 12 hours in a ER before, and was
Mhm.
exposed. And so having doctors that know their patient and know that, hey, if they're calling in, we need to try to see them if it's the lungs is very critical. And that's one of the things we're trying to spread awareness of as well, especially if it's MDA5 or a patient that has ILD, how important that is.
Well, and
Yes.
one more little tip
Okay.
related to that, this is where knowing what your primary care doctor versus your specialist versus your ER versus your home infusion nurse, knowing what each person can do for you and which questions they can answer is important. It would be very overwhelming to me, honestly, even as a physician who has a lot of knowledge. If Benita came to me and said, I'm having lung symptoms, I need you to manage it, that's intimidating to a primary care doctor, right? But if she comes to me with the question of, I'm having lung symptoms, I do have my dermatomyositis specialist, I have regular communication with them. What I need from you, Dr. Diaz, is to do a COVID test so I can rule that out. Or I would like for you to maybe help me with a chest x ray so we can make sure that I don't have fluid in my lungs. And that way I can communicate that back to my specialist. That helps, that healthcare professional to know what their role is and to really know what you're asking. So they're not intimidated thinking that they're now becoming your dermatomyositis specialist. That's really not what you want them to be. You want them to be
Right,
their
right.
primary care job or their home infusion job. Hey, home infusion nurse, what are my vitals today? Are you worried about them? Are they out of parameter? Can you communicate that to my physician? This is how you can educate and advocate for your team to work for you better.
Mhm. And also just because it's so hard to get into our specialists sometimes if it's a critical situation like that. And for example, all of us, our specialists are an hour or two away. So if it is critical, we just need somebody to do a quick check and say, do you need the ER or do you need to, or are you okay to go home and wait till you can see your specialist? And that's where that teamwork comes in so handy. Thank you for clarifying that.
Yeah, that was fantastic. I am going to turn it over to Jason because he has a couple of questions for you.
Yeah. Thank you for being here. We're excited that when Benita told us that you and your family were going to be joining us for the Moon Walk this year. I'm just wondering though, why do you think it's important for the medical community to participate in awareness events such as the Moon Walk?
Yeah, that's a great question. This is one of the precepts of our profession is ongoing medical education, right? And that comes in many different forms. It's not just about reading research articles. Sometimes it's about advocacy, awareness, realizing how a disease process can present in different people, realizing just the day to day of how it truly affects people and families. I think it's very important that there are times when we all come together and, first and foremost, fundamentally, see each other as human beings who care about each other. You know, I can't cure dermatomyositis, but I can say, I'm so sorry you had to have an extra blood draw today. I know you've had a lot of blood draws. Just the fact of someone acknowledging those little human things can make a huge difference in the course of this for you, right? We all want to feel that human touch, that human care. I can't take away your difficulties, but I can acknowledge them and empathize with that a little bit. And just having someone who cares makes a big difference. So I think showing that care and showing up is really important, first of all. And then having the humility to say, hey, we all need to learn about this. We need more research. We've done people a disservice by not learning enough about certain conditions. That's huge, and that's where your voices are going to be very, very important in your communities, and in even bigger spheres to push for more research and push for more therapeutics and advance our knowledge of this disease process.
Oh, most definitely, 100%. Because I know that in a lot of our groups, that's one of the biggest things is trying to find a doctor who truly understands myositis in general. And it was hard for me when I first started hearing that, but like you said, having that interaction, learning more. That's I've been doing this for going on 9 years, and I'm still learning something new every day.
Mhm.
And that's the great part about it. And being our own advocates is huge. So having somebody such as yourself and you know others in the medical community to come out and see what we do, and so you can go back to your patients and say, hey, listen, like you said, I might not truly understand what you're going through, but this is what I know. Instead of going in and going, well, I don't know. You know, that's for us, hearing that as a patient myself, hearing that, I think does bring a somewhat a bit of a relief going into a doctor going, you know, I might not know everything, but this is what I have found out so far. That to me personally, that's huge.
Mhm.
Yeah, that's right. People I think go into medicine, they go into their professions with a lot of passion and a lot of excitement and love of learning. You get burned out both in medicine and many other fields, and you forget the joy, that's sparked by learning something new and connecting with people. And I think events like this can kind of bring back some of that joy. For me, family medicine is all about the families and getting to know Benita and her daughters and their musical talents and seeing her as a kindergarten teacher first. My mom was a teacher, and I can really empathize with that. But seeing how, when she was no longer physically able to stand up and teach all day, how she took those skills and talents and put them into advocacy at the service of this community. It's been amazing to see that transformation and inspirational to all of us. We all love her and are so proud of what she's done for this community. Olive and Nova is supporting you today.
She's gonna make
And
me cry.
Well, we all feel that way about Bonita too, so I'm
and I
not
know you
surprised.
each, you all have your own family connections and connections with your physicians and specialists. And this story is just multiplied out across this community. It's a really beautiful thing to see that and to have that camaraderie for all of you. It's isolating to have a rare disease and to be able, even though it's physically difficult, to come to an event like this and to stand all day and walk and participate in whatever way you're able to. It's amazing to have that camaraderie and support and to see a lot of other people and the challenges that they're dealing with and how they're doing it. You learn a lot from the resilience of others.
Yeah, that's true. I mean, like you said, you know, the physical part, yes, can be hard, but what's going to help though, compensate for that is the mental part. Knowing
Mhm.
that you're not alone in this community,
Mhm.
knowing that you're not alone in the journey, it helps everybody.
And also, I think knowing that we're not alone in the medical community as well, by
Right.
having doctors such as yourself that participate, that come to these things, that do these things. I think it's very easy for us as patients to get jaded with the medical doctors. And so it's really refreshing and wonderful when we have doctors like you that show that, hey guys, not all the doctors are tired or jaded. You
Mhm.
care. You do
Mhm.
care. You're and I think
Well,
that's important and that's a great reminder. And I think that was why it was so important to have you here today with us, is to show our community, guys, don't give up on your doctors. They don't give up on you. You don't give up on them. And that it is, as Benita has said at the beginning, it is a connection. It is a communication. It's a two-way street. It's a partnership with your doctor.
mhm.
Um, and you're living proof of that. And we really appreciate that. Benita, do you want to I know Dr. Diaz's time is very valuable, and
Yes,
she is a
ma'am.
very, very busy woman. Do you want to go ahead and close us out with, and Dr. Diaz, if you have any final thoughts as well?
Well, I'll let you, Dr. Diaz. Did you have anything else that you wanted to share before we close out?
I just want to thank you all for your participation in this and for facilitating this conversation. I hope that it's brought some spark of joy or happiness or hope to any of you who are out there struggling, and just trust yourself, trust your instinct. It's hard to know sometimes when you need to move on from a physician patient relationship or when you need to maybe just change the way that you're advocating for yourself. But trust yourself. And if you're feeling that you're not being validated, you're not being listened to, you deserve to have someone who does that for you, and you deserve to have that communication with a physician. So don't be afraid if something's not working to approach it a different way, to move on, to try a different communication strategy.
Well, thank you, Dr. Diaz. I appreciate that. And like I've said before in our community is, my goal with this event, first of all, it's just every time I see the rocket, I just kept thinking, oh, moonwalk, moonwalk. I need something, myositis moonwalk themed and stuff. But my biggest goal too, and Dr. Diaz knows this, is I was really big into um, mental wellness and things like that before this happened. And it's like if that, that I'm always trying to smile. So when I'm not smiling there, they know I'm really, really in bad shape. Because it's like I try to just laugh and still be happy and joyful because I know that there's research out there that happy brain and things like that, it helps you deal with stuff. And so when I came up with this moonwalk, it was to try to bring some joy and some light into this dark disease that we have, and to come together as a family, as a community, and to just have a moment of fun. A lot of things out there that we go to are workshops and things, and it's all about our disease and the bad stuff and the negative stuff. And I wanted us to have something positive, something healing. And last year, I was stopped by so many people that told me how much it meant to them to be together in the same place with somebody that experiences this and to learn from each other, and how we're not a cookie cutter disease. We're not one size that fits all. And for the medical community to come out and see more than one of us and to see how it's so different depending on each patient and how important that voice is, in not treating us like cookie cutters, but as like Dr. Diaz says, the individual that you are, getting to know that patient and how important that is. So I am so excited that you will be attending with us this year, Dr. Diaz, on Saturday. She won't be there on Friday, but she'll be there with her family on Saturday, and I'm excited to have them walk along with us. And thank you again for taking some time out today. Thank everybody in the office for taking care of me, and I appreciate it so much. So with that, we will see you again on the next episode of the Myositis Three Musketeers. Have a great day, everybody.